Hi, everyone. We're going to go ahead and get started. And I realize this is a small room and you're probably wondering why on earth I'm using a microphone in such a small room. It's because our presenter is actually joining us virtually, and this is how she can hear us. So if you have a question or a comment, please make sure that you get the microphone so that she can hear what you're saying. I think we're good, Pete. Thank you. Well, thank you all so much for coming on a Friday. I know it's been a busy week with your bosses coming back and getting started back into the new year. So we really appreciate you taking your time today to join us. I know many of you, but for those of you who I don't know, my name is Lori Kirshner. I am the grantee on the Developmental Disability General Assembly briefings, which we will be doing 4 of these sessions this year. So please be on the lookout for future sessions, really with the intent of helping you and your bosses better understand the challenges as well as the victories for those with developmental disabilities. So thank you so much for being here. Like I said, our presenter, Kara Whalen Smith, is with the Ohio Colleges of Medicine Government Resource Center, is joining us virtually today. She is the author of the Transportation Accessibility for Ohioans with Disabilities 2021 report. Kara, can you hear us okay?
Yes, I can. Can you hear me?
Yes, great. So with that, I am going to turn it over to the subject matter experts here. I'm going to pass actually, you have your own mic, don't you, Paul? I'm going to introduce Paul Jarvis, who is with the Ohio Department of Developmental Disabilities, and we'll go from there. Thanks, Paul.
Thanks, Lori. Yes, my name is Paul Jarvis. I work for the DD Council. The DD Council is a federal program. Every state and 5 U.S. territories have DD councils. About this time every year, I ask to be transferred to the U.S. Virgin Islands, and that transfer is denied. So I got to sit through the snow traffic this morning with everyone else. We do have a quick change to our panel today. We're missing Dara Walburn. She's from Athens, Ohio. She's a person with a disability, and ironically, the snow made it too difficult for her to make it to Columbus in time today. So a couple of years ago, the DD Council funded a study in 2017 to identify what people with disabilities were saying were the challenges for them for transportation. The DD Council, we provide grants every year to address the way that services are delivered to people with developmental disabilities. And when we develop those grants, we ask for public input. And oftentimes we heard from people with DD that transportation was their #1 challenge. So we said, well, what is the challenge here? Because the state provides funding. We provide funding through Medicaid waivers, and we provide funding through Medicaid itself. If you need to get to a doctor's appointment, or if you're going to work, we have programs there. So we wanted to learn more about what those challenges were. So we did a study in 2017, and we came out with some findings there. So a couple of years later, the pandemic hit, and we said, okay, what's going on now with transportation? Particularly, have we addressed any of the issues that we identified in the first study? And then how did the pandemic impact the transportation for folks with disabilities? So we issued a grant. I want to say, I don't even know how much this grant was for, but the Ohio Colleges of Medicine Government Resource Center bid on this grant, received the grant, and spent the last year conducting surveys and doing data analysis related to the input they received, not only from people with developmental disabilities and their families, but from the people who provide the services, the transportation providers themselves. So with that sort of background, I want to hand it off to our virtual presenter, Dr. Kara Whalen Smith, who is the author of our study. You each have, they are on your table. They're chock full of neat graphs and charts and things that kind of illustrate what's contained in there. But Kara, if you want to take it away, you can give them a little more on what's in the study.
Great, thank you, Paul. Good afternoon, everyone. It's a pleasure to be speaking with you this afternoon. As Paul said, I'm Kara Whalen Smith, and I am a project director at the Ohio Colleges of Medicine Government Resource Center, which is also referred to as GRC. And I'm excited to summarize the main findings from the study for you. First, I would like to acknowledge the DD Council's funding support for this project from their grant from the administration for community living. And I'd also like to acknowledge all of the contributions from our project team at GRC, including Ann Robinson, Fei Zhang, Robert Ashmead, Ian Dunn, Patrick Disman, Vaishu Labichetti, Chasa Deng, Kristen Howard, Christine Brown, and George Poulios when he was in his former position at GRC. So to orient you to what I will be sharing today, I will briefly describe a bit more of the background for the purpose of this project, then describe our methods, share information about the people who participated in our survey, and then finally explain our main findings and key takeaway points. As Paul said, it's been found in the past by DD Council and others that have looked at the needs of people with disabilities in the community that transportation is consistently cited by Ohioans with disabilities as the top unmet need that prevents them from being able to fully participate in the community. As Paul mentioned, in 2016, DD Council partnered with my organization to conduct that survey to find out more about the transportation challenges and released a report in 2017. So a bit more detail about what was found in that report in 2017. There were 5 main findings. First, that finding safe, affordable, and appropriate transportation was often very difficult for Ohioans with disabilities. Second, transportation options did not always operate at the times or in the locations that were needed. Third, transportation options often did not or could not serve the full diversity of people with disabilities in our communities. Fourth, there were major scheduling challenges, which often resulted in long wait times for transportation. And then finally, Ohioans with disabilities reported not being able to make spontaneous or flexible travel decisions, which then limits or prevents their participation in a variety of activities and full community integration. The report also produced 4 main recommendations that emerged from those survey participant responses at the time, which were to improve regulation and reimbursement for transportation in Ohio, to have better communication between riders with disabilities and transportation providers, to better coordinate across agencies involved in Ohio transportation, and then finally to have more on-demand accessible transportation options such as Uber and Lyft. So then now in 2021, this past year, the DD Council was, as Paul mentioned, interested in following up on these 2017 findings and partnered with me and my team. And we sought to answer 4 main questions in this follow-up study. So first, we wanted to know what is the current status of transportation accessibility for Ohioans with disabilities? Second, did participants identify the same or similar transportation challenges that I just shared with you that were found in that 2017 report? Third, were any of the recommendations implemented, resulting in any improvements in transportation accessibility? And then finally, we were interested to know if there were any new transportation issues that have emerged since that 2017 report. So to answer those questions, we conducted a statewide survey. And to develop and implement this survey, we convened a statewide advisory panel of experts. And so these experts included self-advocates with disabilities and also disability and transportation experts from across the state. Of note, our advisory panel members with disabilities comprised more than half of our panel, so that they had an equal voice at the table in both guiding and informing the work for this project. And so then our advisory panel was closely involved in the development of an accessible survey and advised us on the prioritization of key survey items to include in order to answer our 4 main study questions that I just shared. And then we worked closely with our advisory panel and other partners from across the state to distribute the survey in several accessible formats over the course of 11 weeks. The survey was open to all Ohio adults ages 19 and older with any type of disability, and is also open to any Ohio transportation provider. Then in terms of analysis, we conducted appropriate quantitative analyses of all of our closed-ended multiple response option survey items. And then also we did qualitative analyses of any of our open-ended narrative responses. I'll also add that for our participants with disabilities, we were able to apply a statistical methodology based on other representative surveys in Ohio to produce better estimates to make the estimates that are in the report more representative to all Ohio adults with disabilities. But I will note that because the survey was not a randomized sample of our participants, the results are mostly limited to what participants in this particular survey report. Okay, so then in terms of response, we had 707 Ohio adults with disabilities complete this survey. And we had responses from a wide diversity of all the different functional disability types. And then also, I'll note that the demographic characteristics of our participants with disabilities closely aligned with the demographic characteristics of Ohio adults as a whole. We also reached people with disabilities in all regions of Ohio, as you can see on this map, and specifically we reached 77 out of our 88 counties. Then in terms of our transportation providers, we had 233 participate, and we reached, again, transportation providers in nearly all of our counties, with the exception of Vinton County. And we also saw a variety in terms of the types of transportation providers that responded to the survey, with the most being non-medical transportation providers. So now I will take you through our key findings that have been organized by the 4 overarching study questions that I shared earlier. So our first question, as a reminder, was to determine what is the current status of transportation accessibility for Ohioans with disabilities. And based on the results of the survey, we concluded that transportation accessibility continues to be a challenge from both the perspectives of participants with disabilities and transportation provider participants. So specifically, some of the top barriers that were cited in terms of finding a ride include issues with scheduling, the affordability, the inability to make spontaneous changes to travel plans, and encountering issues with not having accessible transportation, such as being able to accommodate a wheelchair. Additionally, the figure on the right represents some key themes from our open-ended responses from participants with disabilities when responding about their general thoughts on transportation in Ohio. So these themes included reporting not being able to find rides, again, not having flexibility in scheduling, not having options in their community that work for them, not being able to afford the cost of transportation, not having options in rural areas of the state, not being able to depend on the reliability of transportation, just needing more options in general, as well as the need for expanded services, such as offering evening and weekend services, and then a desire for current transportation policies to be improved. So on the next two slides, I'd like to read for you a few representative quotes from participants with disabilities that illustrate some of these findings. So one participant said, there are no transportation methods in rural areas, not before COVID and not now. If transportation keeps getting worse, people who work at jobs in the community, especially on weekends or at night, will not be able to keep their jobs. I can't go to church or grocery store or just out because I have no form of transportation and no way of paying for an accessible van to get me to the grocery store or just out for a ride. All of the companies that provide transportation for people like me with developmental disabilities are terrible. They are almost never there when scheduled, either early or late, sometimes making me wait hours. Medical transportation requires the doctor a patient sees most often per year to somehow determine how many trips the patient will need. If the patient has an extensive medical team, which includes different specialists, doctors would not be able to predict who a patient would visit, how many appointments or trips would be needed in any given block of time. Please make transportation a possibility to everyone so that we can be successful in our communities. Consider paying drivers more. Figure out how the waiver can pay for Uber and Lyft. So all of these quotes illustrate that transportation accessibility for Ohioans with disabilities is continuing to be a challenge. So our next study question was, do participants identify the same or similar transportation challenges as participants from the 2016 survey? And based on the results, we concluded that participants did again identify the same or similar transportation challenges as the participants from that 2017 report. So we specifically followed up on the affordability of transportation, the operation times and locations, the wait times, the ability to make spontaneous decisions, and serving the diversity of disability with the community, and found that these previous transportation challenges identified still persist today overall for a majority of our survey participants. Our third study question was, were any of the recommendations from the 2017 report implemented to improve transportation accessibility? And again, based on the results, we concluded that it does not appear that the 2017 recommendations were effectively implemented. So specifically, our transportation provider participants continue to cite regulation and reimbursement as being a major issue for them to provide the services that they want to provide to Ohioans with disabilities. Participants with disabilities continue to cite the need for better communication between riders and providers. Transportation providers still cited wanting better coordination across the agencies involved in transportation. And finally, participants with disabilities continue to cite the need for more on-demand, accessible transportation that is able to serve the diversity of disability within the community. One specific finding that we wanted to highlight today was in terms of communication. So both participants with disabilities and our transportation provider participants were asked if they felt there is excellent communication between riders with disabilities and transportation providers. So on this slide, you can see the striking difference in responses to the same question. So specifically, only 22% of Ohioans with disabilities felt that there is always excellent communication versus the 71%, or in other words, the majority of transportation provider participants who thought that there was always excellent communication. And also striking that no transportation providers reported that there is never excellent communication, whereas 8% of Ohioans with disabilities were reporting that they felt there was never excellent communication. Now, these responses do come from two different groups with different sample sizes, so they cannot be directly compared statistically, but the differences in the distribution of the responses are noteworthy and something to pay attention to, and may indicate a disconnect between what providers are thinking that they're delivering and how they're communicating versus the perceptions on how people with disabilities are actually experiencing transportation services. So similar to the 2017 report, participants cited the need for having ride options in their community, making scheduling easier, having more drivers available, having more rides that are able to come on short notice, decreasing the wait times, making communication easier, and having rides that are able to accommodate them. So our final study question was, do survey participants identify any new challenges that were not identified in that previous report? So this survey did identify several new transportation challenges that were not previously reported. So specifically, as I noted earlier, transportation providers may be unaware of the extent of the communication challenges that riders with disabilities are experiencing, or their ability to competently and adequately serve the diversity of disability within their community. Also importantly, the subset of Ohioans with disabilities who seem to be experiencing the most transportation challenges across the state are those from rural and Appalachian counties. Also, like in all other aspects of life, the COVID-19 pandemic has had an impact on transportation for Ohioans with disabilities. So the pandemic has made it more challenging for people with disabilities to travel safely, and has further limited their options, both due to the health and safety concerns, as well as reduced overall accessibility, availability, and scheduling of transportation. Transportation providers also noted that the pandemic, like with other industries, has resulted in losses in revenue, rising costs, staffing shortages, and reduced overall capacity, which has impacted their ability to provide the quality services that they want to provide to Ohioans with disabilities. So the two main takeaways from this survey is that transportation accessibility is continuing to be a challenge, and also that the pandemic has further exacerbated the already existing issues and has further limited options for Ohioans with disabilities. And I'd like to conclude with what survey participants felt is needed to improve transportation for people with disabilities to be able to live in the community, have a job, go to the doctor, see friends, attend church, and so on. So from the perspective of Ohio adults with disabilities, their main priorities for improvement include having more accessible options, having services that are reliable, having policies that prioritize transportation accessibility for Ohioans with disabilities, having appropriate transportation near where people live, and then to decrease the cost of transportation. From the perspective of transportation providers, they continue to cite the need for improved funding, better coordination, decreased rules and regulation, better communication across agencies, and increased staffing. I will also add that there were some encouraging trends that did emerge from the survey. So the results were not all negative. Specifically, it appears that more transportation providers are more aware of their responsibilities under the Americans with Disabilities Act. There also may be more training that transportation providers are receiving than what was occurring in the past. And more transportation providers seem to be interested in wanting to improve and expand their services specifically for people with disabilities. I'll add a caveat there, though, that from the perspective of people with disabilities, current trainings may be subpar when it comes to adequately preparing transportation providers to competently communicate with and serve people with disabilities. Another thing to note is there were also some people with disabilities who said that their transportation is working great for them in their area. And while they certainly were not the majority, perhaps future studies can look specifically at what aspects of transportation are working well for some Ohioans with disabilities and why it's working well, and perhaps find ways to scale those models to the rest of the state. So those are the high-level main findings from the report. I encourage you to review the report and associated fact sheets that we produced for more specific details, as there's a lot of really great information there. And now I believe we're going to move into the panel discussion.
Great, thank you so much. As you can imagine, there was a lot of time and data that went into this report, and I know she shared a great deal of information with you all. We're going to pivot a little bit here. I wish that Dara was able to join us, but ironically, transportation prohibited her from being here. The snow had a lot to do with it, but it was still a transportation issue. So perhaps this is a little more of a conversation than a panel. I would encourage all of you ask questions if you don't understand something, if there's an acronym that someone accidentally uses without explaining it. The alphabet soup document that's on your table, I would encourage you to take that with you. As a former member of the State DD Council, I still refer to that. It's extremely helpful, but that's the purpose of this event, is to really help you better understand not just the transportation study, but the DD community and the issues and the challenges and also the, like I mentioned earlier, the successes as well. So with that, I'm going to turn it over to Paul and to Mark. Mark and I had the pleasure of serving together on DD Council for several years. He's here in capacity as a self-advocate, but he has a wealth of experience as a professional advocate for individuals with disabilities, both at the state and at the national level. So you're in for a treat. I first met Mark when I was a House staffer a very long time ago. We won't talk about that, will we, George? It's where George and I first worked at the House together a long time ago. But I remember that's when I first met Mark, when he was working for RSC, is that correct? Yes. So with that, I'm going to remind you that if you have a question or a comment, just give us a wave. We'll make sure you get the microphone, and I'll turn it over to Paul.
Yeah, I just want to say that I don't have a disability and I don't experience the challenges that people with disabilities experience with regard to transportation. So this is probably all you're going to hear from me today, unless you have questions specific to the study or not. I'd rather Mark, who is a person who has experienced challenges related to his disability and transportation, share your perspectives. So with that, I hand it over to you, Mark.
Thank you, sir. So let's see how I'm going to drop this a little so we can actually hear me. Nobody's ever said they couldn't hear me before. So why am I here today? I'm here because I'm a person with a developmental disability. I chaired the DD Council when the 2017 happened, and people actually want to know what I'm doing. Let me get rid of that. Okay. I chaired the DD Council when the first report came out. Okay, here's where y'all get to take a breath. I was an LSC fellow almost 40 years ago. Takes my breath away. 83, 84, I was an LSC intern. Went on to be a staffer in the Senate. Went on to be liaison for RSC, now OOD, Opportunities for Disabilities. Went to DC, spent 2 stints as congressional liaison for the National Council on Disability. Came back to work for DODD and have done a few things. So I tell you all that to say, transportation here, there, and everywhere has been one of the banes of my existence. I'll give you the example today. It's been a while since I came into the Rhodes Tower. You can't get to the Rhodes Tower to here without an ID now. CODA does, we'll talk about paratransit in a minute. CODA, the paratransit, does a great job, but when I try to get them to drop me off at the State House, it doesn't come up in the computer. You try Capitol Square, nope. So I got to have them drop me off at the Rhodes Tower because that comes up in the computer. So now I get dropped off at the Rhodes Tower and I couldn't get over here today. I had to go get a security guy with an ID to get me over here. And I worked in the State House for years and all of a sudden I can't get here. And Paul's going to have to walk me back through the Rhodes Tower to get my ride. It's just those little interesting things that happen in your life. And so I tell you that to say, everywhere I go, I add an hour to every trip. I had to be here by 11 just to make sure. So I got picked up at 9:45 and there's a half-hour window for that under paratransit. And they did a great job. They picked me up at like 5 after 10. It was great. But there are times that you add an hour to everything. I'll give you one other example and then I want to talk a little bit about the ADA and how this all works. Years ago, I was finishing in the State House and I got a ride to go home. At the time I was living at Carl and Morse. They dropped off somebody just north of where I was, just north of Morse Road on Carl Road. And I said, oh, this is great. You know, just drop me off at the corner or just take me home. He said, no, my schedule says I have to go to Bethel Road, drop them off, and then come back and drop you off. I sat on the van for 2 hours. And how does one, as you can tell by the gray and the lack of, I'm not a young man anymore, I'm 64. So sitting for long periods of time can be a bit of a challenge on the pain spectrum. And so, you sit there for a couple hours, but it wasn't the driver's fault. The driver has to follow the route that they give him. And I said, well, just stop the van and let me get off and I can wheel the rest of the way home. Nope, not allowed to do that. So I had to sit on the van for 2 hours and it's not his fault. And so you ever have to call somebody and you're trying to get through and you're trying to take care of your problem with your cell phone, there's a goodie, with your cell phone and you don't want to yell at the person on the phone because it's not their fault. It's the same thing with the driver. You don't want to yell at the driver, it's not their fault, but it's like you're stuck. And that's one of the problems with transportation. So let's go back and talk about the Americans with Disabilities Act for just a minute so you understand the context. And I'll try to do this fast because I know I get boring because I give you all the times I worked on the ADA, the original and the amendments, and it gets all boring. But basically when we passed the ADA in 1990, if you had a fixed route bus system, and we'll talk about rural in a second, I don't want to forget about rural, but if you have a fixed route bus system like Columbus, Cleveland, Cincinnati, you have to have paratransit, which means if people have difficulty using the fixed route system, you have to have a paratransit system that allows them to get around. And that's what they have in Columbus, and it's a pretty good system. But that's where this came from. This came from the Americans with Disabilities Act in 1990. So let's talk for a minute, and Paul, you are going to help me with this a little bit. I'll give you a warning about it. You'll help me with Athens a little bit. Then think about the fact that if you don't live in an urban area, many of your members represent rural areas. And last time I read, I'm a little rusty, but I read once that Ohio is one of the states with the most urban and rural areas in the country because we have so many urban areas but so many rural areas. Think if you're in a rural area and you have no fixed route transportation, you have no CODA, you have no whatever, then you don't have access to paratransit. And so DD Council has been trying to do some pilots on that. And DD Council helped with grants down in Athens County so that people could have some on-demand transportation in Athens County. Would you just cover the Athens County just for 2 minutes for me? Please
sure.
do.
Forgive me, it was not my grant. My grants are dedicated to advocacy on behalf of people with disabilities.
So I just threw him an unfair curve.
Yeah,
that's
okay.
Anyway.
So we over a decade ago, the DD Council decided that it needed to do something about transportation in rural areas of the state. So it started out as the grant itself was called the Transportation Anytime, right? So one of the things we heard was there's a fixed route, but it ends at 9 and my job goes till 10 and I can't get a ride. So we issued a grant, a notice of funds available is what we call it. And some folks competitively bid on that. And a group of folks in Athens put together a proposal that provided transportation anytime outside of the normal fixed route area of the city of Athens, because the city of Athens does have some transportation. And it said, no, if you need a ride to work or whatever, you can call. It's going to cost you $1.50, but we'll take you anywhere you need to go. So a lot of times when you have a disability, you might have transportation options available to you, but it's only available to you if you need a ride to the doctor. Well, then my waiver will pay me and I can call and they'll come and get me. Or if I have a job at there's a workshop or something, then the county board will come and pick me up and take me to my day program or workshop. But if I need to go get groceries or I work in the community, that's when things became a little more challenging. So we've had a grant for over 10 years. I think it just ended, and they're looking at ways to raise money through the county property tax levy to pay for that, because they want to keep that service. They like it. The community likes it. So that's an example of one of our transportation grants that looked at a rural area outside of the normal fixed routes. Is that what you were getting
That's
at, Mark?
exactly what I needed. And so I'm going to give you one more example, then I'm going to tell you why I think this might have some value to you. Because I think the reason you're here is not to hear some old guy who was an intern 40 years ago, but what can you take away that actually has value to you? By the way, I'm actually most people don't like to talk about their age. I'm proud of it. I'm still on this side of the dirt. And a lot of people didn't think I was going to make it. So I'm very proud to be old. So I have no problem with it. I wouldn't have minded if I could have kept a little warmer, but that didn't work out. That's genetics. So here's it. I had to come down to testify during the budget. And you guys all know what budget hearings are like. So I had my scheduled pickup at midnight, the last time I could get home. Well, the budget hearing went till like 2 in the morning. So I lost that ride. There are accessible taxis now. The thing is, can you find one that's actually out at 2 in the morning? Because Uber and Lyft may be wonderful, but when's the last time you saw an Uber that I could get this chair into? So, I'd been around the State House long enough then that the State Patrol guys knew me. And I said, you do realize that if I can't find anything, I'm going to have to go over in the corner and go to sleep, which I have done. I have spent the night sleeping in the State House. I know where all the corners are. I know where all the little places on the 3rd floor where nobody knows where you are. I tell the State Patrol. But this time the patrolman, he gave me a cup of coffee and he said, if you can't find a place, we'll give you a corner. Well, luckily I found a taxi cab on the street at 2 in the morning that took me home. But those are some of the challenges. I mean, I'm prepared. I always have a protein bar in my bag. Worst comes to worst, I have water. But people get stuck places. And so part of your challenge as staff, you're going to get calls. I get stuck here, I get stuck there. What am I going to do? Well, I've been around long enough. If you're a person with a disability, you always have at least 3 plans. And if all 3 of those don't work out, then you're kind of out of luck. I had to go get some new batteries in my chair a few months back, or last year because it was snowing. And I thought, I've got 3 ways to get back. None of them worked. This was plowed in, that was plowed in. I eventually had to look both ways, wait till the light turned red, and go out on the street for about a block to get around the snow to get back where I needed to go, because all 3 ways that I had planned didn't work. So please understand, as a person with a disability, I always plan 3 different options, and if all of them don't work, then I'm out of luck. So for you, the question is, one, I'm a little biased because I was chair, but DD Council is a great source of information. So if you run into trouble and you're not sure where to go, call Paul, and if he doesn't know the answer, he'll try to point you in the right direction. I'm not saying you're the oracle that knows all the answers, but you may point in the right direction. Now, real quick, and then I'll try to take a breath, since everybody seems to want me today. DD Council, just so you know, and you may have already done some of this, so I'll make it quick. Under the federal DD Act, every state has to have a DD Council, and it's comprised of people with developmental disabilities, me, staff from state agencies, and parents and guardians. Now, this is a really good setup, and here's why I want you to understand that. There is a bit of dynamic tension between folks with disabilities and parents and guardians. Because parents and guardians, and this is my opinion, take it just as my opinion, it is not fact. Parents and guardians are worried about warm, safe, and dry. I want my child or the person I'm responsible for to be warm, safe, and dry. Folks with disabilities want to push the edge of the envelope, want to try new things, want to get a job, want to do things. Sometimes those aren't always in concert. So some of that tension on council is a really good thing. And then you have the state agency people that say, well, now wait a minute, you want to do this, but we can't do this under the current statute or under the current regulations. And that tension makes for great policy, great possible grant opportunities, because we're trying to make the system better. And if you don't listen to all three of those components, the folks in the agencies that have to put it into place, the folks with disabilities that actually have it impact them, and the parents and guardians that have responsibility. So that's why don't fall out. It does. And it's worked for many years. We're really, I forget the last time it was supposed to be reauthorized.
2007 was when it was due.
Yeah, so I've lost count, but it does work. So if you have challenges in this regard, this is a long report. First thing you do is read the executive summary. Then you go to the back and read the handouts. After you do that, page through it and see how it impacts your district. Say, what will this do for my boss? What will this, maybe my boss wants to say something about this bit of information that impacts his or her district. Because I know there's only one or two of you, and you don't have time to do all this. I worked in the State House, and one last story. I worked in the State House, don't fall off again. We had one computer in each caucus. That's when there were no computer. I had to keep the state budget on my desk because my boss was so brilliant. He knew every line by line. So
an abacus does not count as a computer.
Sorry, I'm sorry. So yes, I understand. So I understand how much you have to do. And my boss had been in the Senate for 27 years when I started, so he knew more than I'd ever forgotten. This is back before term limits, can you tell? So I understand that you have very limited time, but take from this that this can be a real resource for you because in my opinion, and most of my developmental disability is physical. I have cerebral palsy. We're not sure what my intellectual capacity is as I've gone on or not now. There are those challenges, but yes, we're not sure. But realize that this impacts your constituencies, and folks are going to want to go to work. I've been really fortunate. I've busted my sorry backside for all these years, but I've always had a job. It meant that I had to get there 2 hours early and stay 2 hours late. And that's just, and I've been married. By the way, here's a fun thing. I married, my wife was an aide in the house. I was losing my composure when this one. I met my wife when she was an aide in the house. She, of course, has a master's in public administration and a master's in social work, and she's a college, adjunct professor. Marry up if you can. I married up. My wife was brilliant, and actually, if I hadn't worked in the State House, I never would have met her. She was stayed in the House. She was staff for the Ways and Means Committee chair, so she knew more on taxes than I ever forget. So I've gone on too long. Use these things for ways that'll impact your constituents, because folks with disabilities want to work, or they want to be active in the community. The days of, the person with a disability lives in the back room of the house, those days are gone. And people want to be listened to. And I really wish Dara was here, because Dara has made amazing strides just in the years that I've known her. One of the great things, I promise this will try to be the last thing. One of the great things about DD Council is it's this wonderful percolating crucible of great things. People have gone on from DD Council to serve on county boards of DD, to serve on other nonprofit boards. And the people really grow and develop because we have expectations. And let me leave you with that. When you become and try to chair a board with 33 people in it when you've got a PhD over here and a person with a significant intellectual disability over there. Try to chair a board of 33 people like that. And that put me through the crucible. I learned more being chair of DD Council than pretty much anything else I've ever done. There are a few others. So take this with you in a way that says, how does this impact the people in my district? And how can I use it to nudge here and there? And so that's what I would leave you with.
Yeah, I'd like to open this up for questions. Does anybody have a question or thoughts, or? It's okay, questions are good. We answered all of your questions on transportation for people with disabilities. So this will be solved by the next budget.
Yes. Great. Well, I'm sure you all noticed there are copies of the report on the table. Please grab one, take it back for your own reference or for your boss's reference. The alphabet soup document is also fantastic. Keep an eye out for our next General Assembly briefing. We're not quite sure what the next topic is going to be. Yes, that's on my list as well. Also, March the 1st is the annual DD. Oh gosh, Shame on me. March the 2nd. That was a big snafu. March the 2nd is the annual DD Awareness and Advocacy Day, which I'm sure if you've been at the State House for any amount of time in the past couple of years, you'll remember. So we have a huge contingency of self-advocates and parents and others who come to the State House and just keep the transportation piece in mind as well. You know, it's not easy for many of these folks to get here. So your time that you spend with them is so very appreciated. We're doing a hybrid event this year. So because some folks have concerns with COVID, understandably, many of these individuals have compromised immune systems and otherwise. So some of our folks will be joining us virtually, some will be in person. So we're going to be offering virtual legislative meetings as well. So we ask that you please consider working with us on that and your patience, and really trying to focus on trying to engage some individuals, particularly from the rural areas that haven't been able to participate in the past, primarily because of transportation issues. So we're hoping that we can plug them in at least from a virtual avenue. So you'll be hearing from us very soon about that.
Yeah, just a quick comment on that. We usually have the event, there's a program in the morning, 10 o'clock in the atrium. And then we ship folks off to talk to their legislators, and we give them the typical, here's a fact sheet. But if you do engage with advocates from your district, just ask them what's going on in their life, and they're going to tell you that what's going on in their life is more important than any fact sheet that they hand you. Now, the atrium will likely be full, but if you get a chance, we're bringing back an individual that participated in this event a couple of years ago. He's a person with autism, and he plays guitar. His name's Zane Harshaw. You might have seen some stuff recently in the news about him. And he came to the State House a couple of years ago and played his guitar, and it was so good that it brought Governor Kasich out of wherever he was, and he said, "What's going on here? How come I'm not speaking at this event?" We're like, "Well, we did invite you, sir," and you said no. But he said, "Can I talk? Can I talk?" He really wanted to be a part, because Zane is such a fantastic performer. So if you find that, hey, I got a few minutes between 10 and 11, I might stick my nose into the atrium around that time just to hear Zane play. Did you have anything you wanted to add to that?
No, I'd forgotten the John Kasich story. That was just amazing. I know, I guess I want to just close with, I know this report is a lot. I remember what my desk used to look like. You get at least 5 of these a week. So just pull whatever out works for you, and then call Paul if there's anything else with DD Council. Yeah, I know I get in trouble. Isn't it wonderful to call somebody else, not me? But I'm excited because when they brought out the original report in 2017, I was doing education then, and we still have a long way to go. Ohio is a tough state. If you live in Columbus, you have one experience. If you live in Vinton County, you've got a totally different experience. So it's a tough state. And in my younger years, I traveled the state a lot and got lost a lot before GPS. And that made a real difference. So this transportation, Paul, the 3 big issues that we deal with most on DD Council, I'm not a member anymore, forgive me, are transportation, housing, and employment. And you hear that from all your constituents. It's just you're learning from us the point of view with folks with disabilities trying to deal with this. Okay?
Thank you.
Thank you.
Oh, gosh, sorry. I am forgetting everything today, Paul. On your table is an event survey. If you don't mind just taking a quick minute and filling that out for us, it helps us plan for future events and helps us to be able to assess how much y'all are learning from these. So thank you. You can just leave them on the table. Thank you.